mission of Home to Enhance African Life is to form servant leaders among poor and marginalized orphans, widows, and rural villagers in West Africa, through education, advocacy, and spiritual formation in the self-emptying spirit of Christ. Because HEAL's mission reaches into rural areas stricken by poverty and poor sanitation, our work includes addressing the basic needs of food, shelter, and medical care. Good medical care is rare in Nigeria because private hospitals require payment up front before treatment, and because health providers and public hospitals are often on strike due to government corruption. This video will show how HEAL's community of missionary sisters, the messengers of justice, have been impacted by the broken medical system in Nigeria, and how we plan to remedy the problem for the purposes of HEAL's mission. Reverend Sister Callista Utazi was born on November 3, 1976, in Nsukka, Enugu State, Nigeria. Her parents, Mr. and Mrs. Ezugwe Utazi, died when she was a young girl, leaving her an orphan. With her uncle's support, Calista completed her primary and secondary school education in Enugu and began to experience God's invitation to become a religious sister. In her search for a religious community, Calista was referred by a friend to the Messengers of Justice congregation, based in Imo State, and founded by Deacon Leo Okonkwo. She fell in love with the congregation because of their apostolic work with orphans. After her postulancy and novitiate formation periods, she made vows of poverty, chastity, and obedience on January 13, 2013. Sister Calista served God's poor and marginalized people with great compassion, a virtue she developed as one who experienced life's hardships as an orphan. Whenever she was corrected by her superiors, she always responded with a smile and a greater willingness to learn and improve. Calista blessed the community with her skill as a seamstress. She designed and sewed all the habits of her fellow religious sisters, as well as the uniforms and plain clothes for the children of the Compassionate Home and Mother Enabler School, both located in the rural village of Umuagwu. In July 2016, Calista revealed to Deacon Leo Okonkwo that she felt very weak whenever she walked a certain distance. Reverend Leo told her to go to the nearby medical center immediately. She was properly diagnosed with an enlarged heart, but the clinic did not have the resources to treat her. Unfortunately, public hospitals in the area were on strike due to disputes over the payment of salaries for health providers. Thus, Sister Calista could not be transferred to receive proper treatment and died on July 23, 2016, and was buried by Deacon Leo and her fellow MOJ sisters on August 5th.
She was grateful till death. I never regretted it. When they started, those of them that she said we are so intelligent dropped on the way. They still didn't make it, but herself made it just because of service. Sister was so dedicated to her work.
The sadness, because I will not say who will saw the habit of the sisters again. Hundreds and hundreds of people will saw it. But nobody can give me Calista again. Nobody in this church, in this world, can give me Calista again. That is the sadness. That is the pain. Unrenewable, irreparable, irrecoverable.
I'm Sister Rachel Ulo. I wish Sister Calista Utazi is alive here today to receive this award herself. But all the same, I feel very happy because I'm proud to have her as a sister. Myself and the other sisters We are proud to receive this award on her behalf because we believe that her spirit lives. And today I would like to say thanks to our father founder and to him. God bless you.
My name is Sister Amarachi Chema.
My name is Sister Ruth Utazi.
My name is Sister AKZ Teresa.
Let Sister Calista Utazi. At any time she did something wrong and you scolded at her, she just put a smile on her face. And now she is already gone. I don't think if we can get anybody like her in this mission because she was so dedicated. And we pray for her soul to rest in peace.
I would say that this our sister Callista Utazi is a good and humble woman. While she was here with us, she took good care of the orphans and the widows in a special way. We pray that the good Lord will grant her soul eternal rest. Thank you.
I must confess that Sister Calista was a caring and humble sister because even for a short while I was able to see how much she loved and cared for our group. Because the habits we are wearing now, the pelican, was told by her. We will forever cherish these habits because it's as if a saint has given us a habit to wear. Thank you.
Sister Callista's tragic passing due to lack of proper health care reminds us of how broken systems of government and human failings can have deadly consequences for the less fortunate. For every Sister Calista, there are countless poor and marginalized orphans, widows, and rural villagers whose health is at risk. Some of the diseases contracted among the people we serve include malaria, typhoid, diarrhea, HIV/AIDS, infant and maternal mortality, and hepatitis A and B. Features of poverty such as poor sanitation, poor hygiene, and lack of medical care contribute to the prevalence of these illnesses. In order to prevent health tragedies among our masters, the poor and marginalized, HEAL is resolved to establish the Sister Calista Utazi Memorial Medical Clinic in the rural village of Mbise, Imo State, Nigeria. This institution will place the health care of our masters into our own hands. The clinic will provide a full range of diagnostic and health treatment services without respect to anyone's ability to pay. The staff will include a primary care physician, nurses, and medical technicians who will be assisted by medical missionaries visiting from abroad to serve the masters. Patients whose illnesses cannot be treated by the clinic will be transferred to a larger hospital. And so, in recognition of Sister Callista's life of self-emptying service, and in our determination to honor her memory by meeting the health needs of the least of God's children, we appeal to your generosity and compassion for the realization of this holy project.
Words alone cannot express the love that you have shown us.